My name is Linda Moore. I'm a midwife in the CUMH, part of the Ireland South Women and Infant Directorate. I'm going to speak to you about the VBAC classes now, which stands for Vaginal Birth After Caesarean. These classes started in the CUMH because of a study called OptiBirth. This was a European-wide study that looked at Italy, Germany and Ireland and their caesarean birth rates. So these VBAC classes were an intervention that was put into place, and it's a formula that was offered to women to see if the second babies, there would be a higher incidence in those babies to be born vaginally rather than by caesarean section. The first part of VBAC class is looking at what VBAC is and what it offers, and looking at the risks of choosing VBAC over choosing an elective caesarean section for a second birth or for this next birth after caesarean. The OptiBirth study is accessible online, and it is very detailed but very simple to read, and I would recommend that people do look at it. So what they look at is that they've done the research about figures and facts on caesarean versus vaginal births. And what they show on research is that women who are educated and who prepare can, with good possibilities, with good outcomes, go for a vaginal birth. What they say on their figures is that for every 4 women who go for a vaginal birth after a caesarean section, 3 will be successful. So 75% are successful. What are the risks of going for a vaginal birth after caesarean? Well, looking at the other risks, so caesarean section doubles the risk of mortality and morbidity. It also increases the risk of postnatal infection by 5, so compared to vaginal birth. Repeat caesarean section, there's an increase in blood loss, increase in blood clots, increase in abdominal organ injury, increasing in infections, increasing in placenta previas, placenta accreta, hysterectomies. On the other hand, uterine rupture varies between 0.2% to 0.7%. That's 2 in every 1,000 births or 7 in every 1,000 births. There's a big range, but that's what the research is showing. The success rates vary of VBAC, as I'm saying, that the OptiBirth say that for every 4 women that do it, 3 are successful. The Association of Gynecologists and the NICE guidelines of 2011 would say that success is between 49 and 87% success rate of a vaginal birth after a caesarean section. The next recommendation for a VBAC class is that you, as a woman having had a caesarean birth, debrief that caesarean birth with professionals. So find somebody who knows about the birth, or the midwife or the obstetrician, or one of the team on the obstetrics team, and ask them to find your notes, review your notes, and for you to talk really ideally with your partner about what happened, why it happened, what was the outcome, and what could be the outcome. With a VBAC class, your next section is about you balancing the risks. For you to decide what would you like as an outcome, what are you going to go towards, and for you to literally balance the risks, for you to look at what am I going to go for now and what am I going to try for. The recommendation is that you go in with an open mind, that you discuss with your care providers your options, that you explore your options, that you plan your birth, and that you talk to other women who've had a VBAC. There are some good websites around, there are Facebook pages on this, so really explore your options. With your birth plan, the next thing that you do is to go to your obstetric team again and discuss your birth plan with them. The next stage with VBAC preparation is that you refresh yourself on the story of labour. So go and find yourself some good videos, or look at that earlier stories that would also be on the HSE website about the story of labour and birth. Immerse yourself in the story of labour and birth. Remind yourself what your body needs to do and what it can do for vaginal birth after caesarean. Your next stage for VBAC preparation is to prepare your body and mind. There is a lot around about this. So all of the things that you could be doing and should be doing in antenatally for every single pregnancy. So your diet and your exercises, your relaxations, your breathing exercises, your exercises, physical exercises, getting this baby in as good a position as possible. You getting your baby in as good a position as possible means that your chances of success are really high. Your next thing that you need to do is really to be aiming for a normal birth. So getting yourself into labour and birth. This increases your chance of success. The next thing in preparation for VBAC classes and for you as a woman who's aiming for a vaginal birth after caesarean is to think about labour. So what are you going to do? What's going to happen for labour? Where are you going to be? Have a plan of care for your labour. Decide what you're going to do. Have little steps of what you're going to do before you get into strong regular contractions. Your body is going to be getting that achy breaky part of it, getting ready for labour, and then before strong regular contractions. When strong regular contractions happen, the research would indicate that the best care and the safest care for you and for your baby is for you to come into hospital and for your baby to be monitored while you are in labour. So therefore, when strong regular contractions happen, you phone the hospital and you come in. And when you come in, you come to the labour ward and your baby is monitored on a continuous fetal monitoring. This is wireless telemetry. These are one of the ways that your baby can be monitored continuously with continuous fetal monitoring. It can be wired, which I will show you in a minute, but I really recommend that you ask for wireless telemetry, wireless monitoring of your baby. This one is for picking up the baby's heartbeat, so it's put on the baby's heart, chest area around your tummy, strapped with the strap, and the other one monitors your contractions, and it goes on the top of your abdomen and it monitors your contractions. So you've got the baby being picked up continuously and your contractions being monitored continuously. But being wireless, it means that you can use any area in the room and you can be mobile and upright, and this helps you to attain a vaginal birth. In the hospital you come in and, as I said, you're strong regular contractions, so we would hope that you're in good strong labour and that your cervix is starting to dilate, the uterus is contracting well, and you're well on your way to attaining a vaginal birth, achieving a vaginal birth. The other things that you can do that will help you to achieve a vaginal birth are the things that I was saying to be practicing in your pregnancy. So the relaxation techniques, your breathing techniques, and the strategies that you may have decided to go for, like mobility, using the ball, using the cub, being upright, standing, changing positions, moving your hips, being on the mat, going on all fours. I also think that you might be thinking about massage, so your partner might be massaging your shoulders, your hips, your legs, your arms, and that is very nice, and it really does help you to cope with the labour. You may have music, you may have chosen to have music, and you may have your playlist downloaded and ready to go. You also may have your breathing and your practices with your breathing. You may be doing some yoga, you may be doing other things like Pilates or other optimal fetal positioning exercises as well. You definitely might be on the ball, using it by bouncing or in a figure of 8 motion, or kneeling on it and rolling it away from you. You may be practicing hypnosis. You may have been doing some breathing self-hypnosis with gentle birthing or hypnosis for breathing. You also may have a TENS on your back, and that's the TENS machine. You may be using acupuncture, you may be using your Entonox, you may use pethidine, and you also may use an epidural to help you along. Everything that I talked about is in the book. Remember to refresh yourself by looking in the book or looking at the PDF of it. I wish you all the very best, and for every 4 of you who try, 3 of you will achieve a vaginal birth. Well done.